Hey, this is Doc Yates. I'm a naturopathic doctor, registered acupuncturist, and a kinesiologist, owner of the Yates Naturopathic Clinic, and the founder of the interactive health website, Able Health. And this is the Simply Health Podcast, a show for females where I work to simplify and demystify the secrets of achieving optimal health naturally, based on my own experience in working with thousands of female patients over the past 15 years of my clinical practice. Welcome to Simply Health. Hey, this is Doc Yates, and welcome to the Simply Health Podcast, brought to you by ablehealth.us. And on today's podcast for perimenopausal and menopausal females, I want to talk about monitoring and testing your hormones. Monitoring and testing your hormones. And I'm just on the drive today, and it is an absolutely beautiful day here today, especially because I'm in Ottawa, Canada. And I'm not sure where you're listening from, but generally, this is February when I'm recording this, and it's generally, it's probably one of our coldest months of the year. And keep in mind, Ottawa is, I think, usually rated as the third coldest capital in the entire world. So generally speaking, right now, if it was going to be minus 20 to minus 30, that would be typical. And it's probably plus 5, and I'm just driving to work, so it's a crazy swing, which is amazing. Except for one thing. This year, actually, my family and I, we decided to try and open a skating trail. And if you don't live in a northern climate, you would have no idea what this is. But this is these are trails through the woods. So it was a 1 kilometer trail through the woods where it was all basically a skating rink, and you could go meet up with your friends and family there. And you go for these nice skates through the woods, and it's all lit up. It's beautiful. It's like Disney on ice, but through the woods by yourself and friends. And unfortunately, this is the one year that we first attempted it. It's just randomly above zero, like every day for this month, which has never happened. So that was a little disappointing, but either way, I'm happy to see the warm weather here. So let's dive in today. We're going to be talking about monitoring and testing hormones. And here's the thing, at least where I'm located, a lot of times people go to get their hormones checked from their medical doctor, and the doctor doesn't really check their hormones. They just look at FSH and LH. And the reason that they look at these particular factors on the lab, or the numbers for these on the lab, is that these are the things that when they start elevating a lot, it means that you're going into menopause. And that seems to be the only thing they care about. They don't care about what your hormones are. And they say, well, it's too hard to measure the hormones because they fluctuate all the time. And the answer is yeah, we know. That's why you're trying to measure it at specific times of the month when someone has a regular cycle, to get an idea where those hormones should be relative to that time of their cycle. And that's how we do it. So, because there's been too many times. I remember when I first started practice, there's so many times where someone would come in, and this was before I was even using bioidenticals. I was still using mostly just natural herbs, supplements, and everything, and acupuncture for the treating of menopausal effects, like hot flashes, night sweats, mood changes, libido, etc. And people come in, they're like, no, my doctor checked my hormones, and they said it was fine, and so therefore all my symptoms are because of maybe a chemical imbalance in my brain. They gave me an antidepressant, and the worst part is that now I've gained even more weight because of that, and it's dropped my libido even more. So it's literally just making them then even more depressed and more down and more anxious. It's just making everything worse. So don't go down that road. Get your actual hormones checked. If you still have a regular cycle, most doctors that are more well-versed in hormonal testing will ask you to go maybe day 22 to day 24 of your cycle. I often like people to go, if you're in perimenopause, you still have a regular cycle, and PMS symptoms are starting a lot earlier, so maybe they're starting a week to 5 days before your period. I want to make sure that you're getting checked during when you have those symptoms. So I want you to be checked within that window so I can see what's going on with your hormones when you're feeling the most off. So generally speaking, it would start like this. I would meet with someone, or you'd meet with your practitioner, and you've got to go through a full list of your symptoms, because the symptoms, in my opinion, it's like nobody cares about symptoms anymore. They just look at you like you're a lab report, and then everything you say is just discounted depending on those labs. It's like, nope, turns out everything you said is wrong. these labs say you're normal, and then that's it, and they're like, move on. And that is not true. Symptoms to me are the most important, and then labs can kind of help verify how the imbalance is working. But the symptoms, you have to go through symptom by symptom. And I feel like there's so many patients that I've seen where their symptoms have been discounted so many times. When you ask them about them, they're like, oh, it's just this. And you're like, no, I need to know, when is this happening, and how much is that happening, and what time of the month is it happening, and all of these other factors related to their symptoms, so you can get a much better picture of what's going on. Then after that, you have to get all the symptoms and in depth. You already, like, from an experience, I already pretty much know what's going on from a hormone standpoint. That becomes, when you've done this enough times, you already know. But just to clarify, and usually for here, our board requires it to start, but I always start then with hormone testing. So then we have that on file. And you do the hormone test usually around day 22 to 24 of their cycle, or when they're getting these symptoms flare up at the worst. Check their levels, and lo and behold, for most cases of perimenopause, the vast majority, progesterone has taken a dive bomb, and estrogen is either normal or slightly high. And for menopause, if you're full menopause, both those hormones are typically low. We just have to determine how low. There are some exceptions to that rule, where sometimes even for menopause, sometimes it's, even though they haven't gotten their cycle, or things can be, they think they're in menopause because maybe they had a hysterectomy, so they don't know what their cycle is like. Sometimes you'll see people who are older and they still have a little bit of estrogen left over. So we run that first test, find out what's going on, and then you start your initial prescription from there. And the thing is with it, no matter what their levels are, the prescription is always starting with a low dose. Because when it comes to hormones, the rule always is start low, go slow. Because even if they're bottomed out to 0, you're still not going to then blast them with a heavy dose, because you don't know how sensitive that person is to hormones. So you start with a very low dose, which is a very similar starting dose for a lot of clients, and then you're gradually working your way up anyways, depending on how they're responding to the treatments. And again, that response is based on the symptoms. So the second thing is that after they've started the low-dose hormones, so low-dose bioidentical hormones, typically all topical, you're monitoring their symptoms for the first 2 to 3 months before you're even retesting. If things after 2 to 3 months are starting to move on track and everything is correcting, then you just maintain. If the first 3 months they're still off, then at the 3-month mark would be the earliest I would consider testing. 3 months would be the earliest. I find there's a lot of practitioners who test constantly, and it takes the body a while to adapt to the treatment and to adapt its receptors. So just to be testing, every month or 2 months, you're just wasting tons of the patient's time and money going to the lab and getting everything checked. So 3 months would be the earliest. After that, generally around 6 to 12 months, depending on how they're responding. We'd probably do a test at 6 months, and if everything's still going great, then we'd be switching to 12 months testing. And again, I'm following up with the patients pretty often and checking to see how their symptoms are going. The one thing you have to keep in mind with perimenopause is that depending where you are in perimenopause, is that your progesterone is taking a dive bomb, but at some point your estrogen is going to follow suit and also start dropping. That's the point where you really want to start to monitor. You have to be sure you're monitoring symptoms to know when to do the next check to check for the estrogen dropping. So let's say perimenopause, and they've got some sleep disturbances, they're feeling a little more anxious, and they're gaining more weight around their midsection. You correct this, you give them something to help balance their estrogen levels, which is not a hormone, generally like a DIM extract, and then you use a little bit of topical progesterone cream in a low-dose bioidentical form. From that, everything's great. Their sleep's better, their mood's better, everything's going great. All of a sudden, 8 months later, they're like, something's up. I'm starting to get like hot flashes or something, or this sensation of heat at night, and then, and my period's getting really light and I'm missing it. That point, estrogen is also starting to follow suit and drop, and you would basically be monitoring the estrogen levels at that point a little bit more frequently, a little bit paying more attention. And initially, the estrogen levels are still there, because the thing is, a lot of these hormonal symptoms, It's not necessarily related to what the exact level is when you're measuring. Sometimes it's related to what is that level relative to what their level was before. So even though their estrogen may be in a normal level, it may be lower than what it was before, and that drop relative to what their body's used to will cause those symptoms of hot flashes, night sweats. If the estrogen is still in a normal range, though, you still don't want to give them estrogen. That's how I do it. I don't like to give a lot of estrogen because I don't want to push it up to a much higher level. You want to let their body adapt to that level. So you manage those initial symptoms as long as they're still getting their period. As long as they're still getting period, if they're getting hot flashes, night sweats, it's very easy to manage those symptoms with just herbal extracts. But once they get to the point that their period has stopped, estrogen kicks in. That's when you start using bioidentical estrogen built in with your progesterone to get those results. And that's how you see the effect for hot flashes, night sweats, dryness. Actually, that is one thing. They're both estrogens, but the dryness aspect, say you're dealing with vaginal dryness at the same time, that is something that you can start while someone still has a regular cycle. But it's a different type of prescription. It's a vaginal suppository. You're only using it twice per week. So that can cut in a little bit earlier than before you start using the daily dosing of estrogen. Again, so progesterone first, as long as they're having their cycle. If they're getting their cycle and they're starting to get symptoms of dryness, you can add the vaginal suppository of an E3, and that's only twice per week. And then after that, when they lose their cycle and you can't manage it anymore, the estrogen symptoms with just herbal extracts, you add in the daily estrogen to the progesterone, and that balances everything. So that is, I hope that didn't get a little too in depth, but that's just kind of how you follow along with the symptom pictures, follow along with the labs, and make sure that you can monitor someone's hormones and monitor your hormones the entire time. So this is Doc Yates. I hope this information was helpful, and I am signing off. Thanks for tuning in to Simply Health. If you want to learn more about health, check out Able Health. If you want to see some of the other projects that I've been working on in health, business, music, and life, please check out the links below.